butuh ini dan BM 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 boleh juga not only being but also for the and in the of how was they have they give a high it is very more the 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 role of the baby and AI the role of the heavy would begin would be the for our body.
It's a pleasure to be with you today. And so, basically, when we look at physiotherapy, I think you've been very kind in sharing about me as being a skilled physiotherapist. But I think, like in physiotherapy, there's a big continuum of learning that all of us physiotherapists are on. So, basically, it is the science that deals with the movement of the body and looks at certain pains and discomforts that the body does have, and we look at how to overcome dysfunctions and in a way make the body as functional and as effective as possible in completing the tasks that an individual would like to. So it looks at how then health can look at various dimensions, especially the dimension of having movement that allows you to complete your tasks, your functional tasks, in a very comfortable manner. So it encompasses manual therapy, and which is a majority part of it, but also has other areas like electrotherapy that supplement the manual therapy and exercises.
What are the different types of visual
So, if we look at the types of physiotherapy, it is basically divided based on the kind of population that it is catering to and the kind of conditions that it is catering to. So, we have musculoskeletal physiotherapy that looks like the name mentions more at the musculoskeletal system. So, any conditions of the joints, the bones, the muscles, the ligaments. So more to do in the field of orthopedics. Then we have neurophysiotherapy that looks more at the conditions arising from the nervous system being involved. So which looks at attacks of stroke, paralysis, neuropathies, etc. Then we have cardiovascular and respiratory physiotherapy that looks at the conditions affecting the cardiorespiratory system and the vascular system, and how physiotherapy would assist in working on the symptoms arising from those dysfunctions. And then we have a fourth very interesting branch. I call it interesting also because it is my specialization, which is community physiotherapy, in which we look at four subspecialties. One is geriatrics, which looks specifically at the conditions that affect those above the age of 65 who fall in the age group above older adults. We have women's health, where we look at the antenatal, postnatal care specifically. Then we have industrial health, which looks at physiotherapy for conditions arising from the workplace. And we have chronic rehabilitation, which looks at how individuals suffering from a chronic condition can overcome certain deficits and be as functional as they can. So then it looks more at government policy and how physiotherapists can assist in understanding the needs of a population that has special needs. Yeah, these are the kinds, but then there are more subspecialties, like there is a specialization in hand physiotherapy, for example, or specifically in maternal physiotherapy. So there are always subcategories to physiotherapy there.
What was of the other organisms and you help you
So, like I was mentioning, there's actually a very big array of disorders and conditions that physiotherapy treats based on the different systems of the body that are involved. So, when we look at musculoskeletal physiotherapy, it looks at both the preventive aspect as well as the curative aspect. So, that makes physiotherapy a very wide subject because we're not looking at only when a disorder occurs, we're also looking at how to prevent it from coming in the first place. So, for example, a majority of patients we work with are those having arthritis, which is a condition that has developed from the wear and tear of the tissues. So, that is one area that we majorly work with in the curative aspect. So, we look at how we can slow down the progression of the disease. But then there are many others. Like, for example, we work with patients who are diabetic, we work with those who are hypertensive to make sure that we curate an exercise program for them that would, in a way, allow them to prevent certain secondary complications arising from their condition. So, in diabetics, we would try to bring down and maintain their blood sugar levels as much as possible with the use of exercise. So, if we look at the kind of conditions that physiotherapy treats, it's a very, very wide range of conditions: musculoskeletal, neurological, cardiovascular, respiratory. And it looks at it in three terms. One is preventing it from getting worse, the other is preventing it from happening in the first place. So, we also look then at the lifestyle modifications that can be done through introduction of exercise. And then we look at curative. So when something has already happened, like say an injury, a fracture, after which there is stiffness after healing, then how can we overcome those dysfunctions and discomforts?
yeah, give me about hydrotherapy and how it benefits.
So, hydrotherapy is actually a very, very interesting part of physiotherapy. And unfortunately, I feel like it is very underutilized currently in the Indian context because it's not very easily available to everyone. Neither is the practice for us as physiotherapists, nor is the easy availability there for patients. But hydrotherapy, because water offers a lot of benefits in terms of the weightlessness that you feel in water, which is very protective to the joints and muscles. So that is one very big advantage of hydrotherapy. The other is the calming effect of water. Because of the weightlessness and the turbulence that water has around you as you move in it. The third is the resistance it offers. So, in a way, it helps you to challenge your system and put in extra effort when you're trying to create movement in water, which eventually leads to more buildup of strength. So these advantages make hydrotherapy a very ideal way of delivering treatment for certain conditions. So to give you an example, if we are trying to increase the amount of exercise that a person who is having arthritis in both knees is able to do, hydrotherapy is sometimes the perfect solution when they are also overweight. Because any other form of exercise would put more stress on their knees and would cause pain. And then they fall into a cycle where, because of pain, they're limiting movement. Because they're limiting movement, they're putting on more weight. They're putting on more weight, there's more stress on the knees. So, in a way, if we want to increase the exercises, one good way to break this cycle is hydrotherapy. And we also use it for many other conditions as well. Like it is encouraged for even pregnant women to exercise in water. It is encouraged for children who have neurological disorders, very, very calming, having exercises in the water. It is used as a great way of relaxation. So, Watsu is one water based therapy that induces relaxation. So, I think it has various uses in the field. But I feel like the amount of training and the amount of resources it requires still lacks in many places, which is why the accessibility is less, but the advantages, of course, are many.
What are the areas for or what is needed to become a physiotherapist?
So, to become a physiotherapist in India, we have a bachelor's in physiotherapy, which is the acronym is BPTH, which is offered by various universities and colleges affiliated to those universities. So that is the basic qualification required. It is a 4.5 year course where I am in Maharashtra, and which is a 4 year course, after which there is a half a year of internship. But it is a beautifully structured course because it allows you enough academic work as well as practical hands on experience. And after that, there is a master's program that can be opted for, which is an MPTH. But then you have to choose a specialization in that. And then it also depends on where you'd like to do it. So where I am, the course was 2 years, but in some places it may be longer than that. So in India, we have the bachelor's and master's course available. And of course, after that, there are many ways in which you can additionally qualify. There are shorter courses of shorter duration offered by various institutions that will help you understand one particular subject better. So, like hydrotherapy is one of the subjects that you can further study about, engage in, or you can look at additional qualifications that supplement your work as a physiotherapist. So, whether it is a certificate course in yoga or a certificate course in Pilates. So you can always keep adding to your qualifications by learning certain skill sets through different workshops and shorter duration courses.
Would you agree that become become a physiotherapist for you not only experience but also for the and in the
I would totally agree because as a physiotherapist, if I look only at my experience depends a lot on what I have had the chance to study and how I have built this skill set. So I think what you gain out of the experience is also molded by what you already have the knowledge of. And I feel like the way that the curriculum is set is very special in that sense because in the first few years, you are studying anatomy, physiology. You're not just looking at conditions and their solution, you're understanding the body as a whole. And then you are going into understanding it further in terms of what can you do as a specialist of exercise. So I feel like that overall knowledge also helps you understand the different systems and how they interact with each other. And then like as you go ahead, you start looking at the body then also as a part of an ecosystem. Like you're now not looking at an individual only as a human body, but you're looking at them also in the context of the environment that that human being is living in. So there are so many other forces that are acting on that person, and you start becoming conscious of it more and more as you experience working with patients. But the kind of experience you have is molded by what you have studied, and during the study what kind of experience you have had. So I think that balance that is struck between just studying versus also seeing patients while you are studying makes all the difference in how skilled you are. And then of course it's a lifelong learning, then you keep sharpening those skills, you keep learning new things. And also in the context of the way things are today, conditions are also evolving. so what we sometimes study in books may tell us what it was like a few years ago. Like it says a condition of degeneration in the spine starts at the age of 45. But now we are seeing it much at a much younger age because we are constantly using devices. Our kind of work has changed, which is why the way that diseases also present themselves is changing. So I think that is what comes out of experience then. You start noticing changes that are very different from what you studied in a book, and you can see the contrast. So I think, yeah, it supplements. To be a good therapist, you need to tie experience into what you have studied and keep analyzing.
in in what with gender or health is
If we look at the risks of physiotherapy or the dangers that it accompanies, it is mostly because of a lack of understanding of the process of healing. So often, like if a patient comes to me the first day and the second day the symptoms are worse, it is understood that we have to, as a therapist, explain to the patient the natural course of healing. So healing is never linear. It's not a straight line. It has its ups and downs. And often different bodies react differently to therapy. So, which is why initially we need to see what suits the person best. And that takes a while and it takes experience to really understand it in a short period of time. So, I feel like that is the major risk that we run, is that when we do not educate the patient correctly, which is, of course, the mistake of the physiotherapist, then we land up with this danger of the patient misunderstanding what physiotherapy is and what it can do. So I don't think, as per se, like when it is practiced correctly, there are dangers or risks. But I think when it is practiced incorrectly, there are dangers and risks. Especially, for example, with electrotherapy, we are using electrical currents through instruments, and we need to be very careful about their application, about how it is used, on whom it is used. So we have to be very thorough. If I use it on individuals who it is not indicated for, then I can land up with complications, whether it is burns or it is any other complication arising from the use of a certain instrument or a certain technique. The other thing is also not explaining to patients effectively how physiotherapy is going to continue. So, if we are not very careful about the do's and don'ts, like after surgery, what you are supposed to do and what you are not supposed to do, if it is not explained correctly, then it is a risk. It is a major risk. So, if we just encourage the patient to move as much as possible, irrespective of the condition that they have, then that, of course, is in a way malpractice on our part as a therapist, and that leads to a lot of dangers.
it that would be have been neurological in the last Parkinson and cerebral palsy. I also I have cerebral palsy. We got by brain damage. Can visually help people be the other light TV.
Yes, definitely. So when I spoke about neurological conditions that require physiotherapy, cerebral palsy is one of the very big areas in that. And like we know that cerebral palsy, because it is damage to the brain, like you were mentioning, it is irreversible damage. So now we come to a point where we are trying to look at what are the current capacities and how those can be built to make an individual as functional as possible. So when we look at cerebral palsy, we try to start off treatment in early infancy itself to help the baby really reach their milestones with more efficiency. So in a way, assisting their movement from one milestone to another, motor milestone. So like helping them to first start holding their head. There are certain techniques where we try to facilitate muscle activation. And then once we are able to accomplish a certain milestone, we look at the next. And because we know that this is a condition that will lead to certain deficits throughout life, more than looking at them as deficits, at a point we start looking at it as chronic rehabilitation. So now, how can physiotherapy help this individual live a life where they are as functional as possible? So, how are we trying to now integrate them into the life of society around them? So, whether it is having them go to a school, and how can we train them to be in that space? or how can we help the government make policies that would make spaces such that it is inclusive of everyone, even those who have a certain special need. So, like in the subject that I studied, when we look at cerebral palsy, we're looking at it as a differently abled individual who requires certain modifications to be made to the environment so that he can engage with it, he or she. But the thing is, to make those changes, you need to be very critically aware of what are the needs of this individual. So now, for example, if we look at a government, like a public park that is being made, how can it be wheelchair friendly? Is one easy way in which it becomes accessible to everybody. So we stop looking at it as deficits and we start looking at it as different abilities that require a different environment. And so to create that environment, there are various ways, one of them also being education. We need to educate the entire population about what this certain disorder is and how it has made an individual a differently abled individual. And to be careful that we call it differently abled
Yeah.
because there are different abilities. So I think physiotherapy here plays a very big role because we're not only looking at direct treatment, but we're also looking at creating conducive environments in which
Mm.
an individual who has different abilities can thrive along with the rest of the population.
Yeah. What is the difference between the and uh,
So, physiotherapy is actually very structured. Because it is very structured, it makes it different from regular exercise. So, regular exercise is something that is encouraged. We're all encouraged to regularly exercise. But when we look at physiotherapy, it looks at the personal needs that I have as an individual and what would help my body. So, often I would go to a physiotherapist even if I am not ill or have any pain to understand what kind of exercises does my body need. So, for example, I may go and do an analysis of how much muscle mass I have, how much fat content I have, and take the help of my physiotherapist to design what kind of exercise program would suit me. How many times in the week should I do aerobic exercise? How many times in a week should I do strengthening? Which groups of muscles should I strengthen? And then also based on certain other characteristics, how can that program be very suited to me? Say, for example, diabetes runs in my family. So, what kind of other lifestyle modifications am I required to make? Which specific large muscle groups can I use that will help to stabilize my blood glucose levels and not make me diabetic in the years to come? So, I think a physiotherapist really customizes and curates an exercise program. But if we look at regular exercise, which is also very, very beneficial, it may sometimes not be so well curated. But then on the other end, physiotherapy also customizes the exercises for those who have particular dysfunctions or have a particular goal that they want to reach. So whether it is before surgery, they want to be prepared for surgery, so they're exercising for that goal. Or post surgery, they want to go back to a particular sport or a particular hobby that they liked to previously engage in and want to go back to it. So I think like what makes physiotherapy different is that we really look at the personal goal that an individual wants to achieve and try to match it also now with, as a physiotherapist, what goal do I see for this individual in terms of how would well-being be defined and how is that goal now going to be achieved through regular exercise, through lifestyle modifications. So it is a very higher order of thinking rather than just engaging in exercise in a very loose,
mm.
unstructured format.
uh, viewer and people in any way.
Yes, very much.
If,
So I think
if, if oh, how the complete, complete,
so. Yeah, like you mentioned your question, I think they very beautifully complement each other. Yoga brings together a lot of aspects that we as physiotherapists would like to bring into our patients' treatment. So, if we look at yoga, it is a very wholesome science that is looking at the spiritual well being of an individual along with the physical well being of that individual. So, in a way, we are trying to look at how stretching of the muscles of the body, holding certain poses, strengthening certain muscles is also helping the mind and the body connect. And in a way, inducing relaxation, allowing the body time to really reflect on certain ways of movement and clarifying certain thoughts from the mind. So, like the way that it incorporates breathing as well, it really connects the different systems of the body. And as a physiotherapist, it is something we would really like. So often for our patients for whom we feel like it would be helpful, we do incorporate yoga into their treatment. Not only sometimes maybe as a stretching routine, but maybe sometimes even as a relaxation routine. Maybe as like at the time of breathing, at the start of exercises or at the end of exercises, the warm up and cool down, we sometimes incorporate yoga into that, the pranayamas we incorporate into that. So they complement each other very, very well. And I don't think there is any point at which they diverse in their goal. So both physiotherapy and yoga are trying to achieve the same goal. And I feel like physiotherapy often draws on the science of yoga. And in fact, in our syllabus for bachelor students, yoga is a portion of it right in the first year. So from the start itself, you start appreciating how yoga is really an asset when you're working with patients.
I that is really of how people in the
Uh,
in you be the time behind how people have in the
if we are looking at sports injuries, for example, every sport has a particular pattern of muscle activation that is required, certain amount of strength that is required. And that's why when someone is recovering from a sports injury and the goal is to get back to that sport, I think they have to really train in a very specific way to go back to what they enjoy doing. And the science behind it is purely that a physiotherapist has a very clear understanding of which structures have been injured and what is the trajectory of their healing, what will assist their healing, and how can they be trained to now function at the same capacity as before the injury. That is one clear way in which, for sports injuries, physiotherapy assists. Then the other one you asked about was stroke. So generally after a stroke, because again it is permanent damage to a neurological structure in a part of the brain, which is why certain deficits will stay on while others can be worked upon. So physiotherapy, there are many techniques in neurophysiotherapy where the science is that we try to help other portions of the brain take up the function of the area that is not functional anymore. And to train that is, of course, a very vigorous process, and neurophysiotherapists work really hard with their patients. And of course, depending on the age of the patient, the extent of the injury to the brain, there are different levels of recovery that each patient will reach. Also, I think there the role of the physiotherapist is to explain to the patient where they have come and what can be expected further. So there are certain deficits that will stay, and that's a point where the patient goes into chronic rehabilitation, where we look at how now with these deficits, the individual can make modifications to the environment and continue their daily activity. And yeah, in heart diseases as well. So we know that after many heart diseases, our uh, so the amount of exercise we are able to do, the amount of movement that we can do becomes restricted. Sometimes it is restricted because we are protecting the cardiovascular system, in which case the physiotherapist can tell you exactly what kind of activity you need to engage in and how much you need to engage in so that you do not create further damage. But then in other conditions, we train the body so that you can better perform based on your ability. So maybe in a long time you haven't really used the system and you slowly need to now make it better. So you slowly need to gain capacity. So, like after surgeries, often when individuals are bedridden for a long period, they have not exercised their system, which is why it loses capacity. And so you climb a flight of stairs and you start feeling breathless. So slowly to train the heart and lungs to really take on that physical load. So slowly the physiotherapist will then prescribe a program that will help you overcome these discomforts like shortness of breath with regular activity.
And me, you name, but important as it is my how does it work and it be better.
So postural correction is a big part of what we do as physiotherapists, especially because currently our working conditions are such that we often are unaware of the way we are sitting, how to correctly use the devices we are using. And so we land up with difficulties, like whether it is a certain awkward posture that is lengthening certain muscles or straining certain other muscles to be used more than they should be. Now, this is often because we do not train well to do things that we regularly do. And when we overdo them, then we land up with pain and discomfort. So, as a preventive measure, when we look at physiotherapy as a training process, so when I am, for example, applying for a job and I know that I'm going to be sitting at a laptop for 8 hours a day, I need to be trained in how to adjust my chair, my table height based on my own body dimensions, and then which muscle groups to strengthen that will allow me to sit up during the day. When I take breaks, what should I do during those breaks to really refresh myself, to make sure that my body is not being overloaded? So, in a way, strengthening certain muscle groups, being aware of the correct postures that we should hold, also being aware that no posture is perfect and that movement is the key is necessary. So, here, as a preventive measure, physiotherapy works excellently when we identify things before they come. So when we know that in people in certain industries suffer from certain conditions, we train them beforehand. We do not wait for pain to come in and then sit and solve that pain, but we look at it in terms of how can this pain never come. So in that way, posture and strengthening plays a big role in what we do as physiotherapists.
AI is the moment made it